السلام عليكم جميعا. أنا نوفل الجريان ومعي زميلي الدكتور عبد الله عبدلي. اليوم نتكلم عن ال Prehospital Care of COVID-19 patients. شكرا شكرا جزيلا لكم جميعا على الحضور، وإن شاء الله نعطيكم شيء إن شاء الله بإذن الله يكون مفيد للجميع. وحنا يعني مستعدين لجميع الأسئلة، أي سؤال ترغبون فيه في أي وقت يا ريت والله ترسلون السؤال ونكون شاكرين لكم. نبدأ أبو أحمد، تفضل. توكل على الله، سوق.
طيب طبعا احنا اليوم ان شاء الله راح نتكلم عن طبعا اول شيء احب اشكر الهيئه السعوديه للتخصصات الصحيه على اتاحه الفرصه لي انا شخصيا اني اشارك. طبعا الدكتور نوفل منتور بالنسبه لي وشخص نتعلم منه في الفيلد، يعني هذا شرف اني اكون معاه في هالمحاضره. طبعا نبدا باننا نقول اللهم ازيل الغمه ان شاء الله عنا، وان شاء الله اننا نخرج من هالغمه باسرع وقت ممكن وباقل الاضرار الممكنه. اليوم راح نتكلم شوي عن كوفيد.
أهم شيء نخلي تباعد مكاني
1.5
مترز. طيب.
اليوم راح نتكلم ان شاء الله اوفر فيو عن كوفيد، نتكلم شوي عن فيرولوجي، شوي epidemiology definitions، راح نتكلم عن assessment in patients with COVID, ال precautions, ال PPEs with COVID, ال personal protective equipment، وراح نتكلم بعدين في الأخير touches على ال pre-hospital management، وفي couple of procedures that we might يعني want to avoid in general. يمكن بتلاحظون during الدiscussion اللي بيصير اننا بنصير يعني على قولتهم lay back شوي، يعني انا بتكلم شوي، دكتور ناصر بيتكلم شوي، بتكون ما راح تكون يعني بالطريقه الفورمال اللي احنا متعودين عليها وشخص وبس، فبيصير في يعني زي الانتراكشنز خلال الليكشر ان شاء الله. طبعا لما نتكلم عن الديفينيشن احنا نتكلم وش الكوفيد. everybody start asking طيب وش الكوفيد؟ COVID is an infectious disease caused by coronavirus 2. طبعا it causes severe acute respiratory syndrome. Now this is actually similar to MERS, SARS, in terms of being positive sense RNA virus, and this is the virology and how it actually gets replicated within the cell. The patient cases طبعا severity ranges from asymptomatic, so pre-symptoms, patient will show up before a symptom that actually caused any red flags, or what we like to call انه become suspicious, ولا you become aware انه this patient might be actually positive. So this one type of patients. Other patients will actually show up يعني a little bit in moderate, where they will have cough, fever. Others will be actually shortness of breath, desatting, وبعدين بنشوف النمونيا symptoms.
طبعا يمكن كويس ننوه على موضوع اللي يتكلم عنهم البري سيمتوماتيك والاسيمتوماتيك patients، واللي we talked about before that they might be the cause of spread without us knowing. وايضا الريكومنديشن اللي نسمع كثير الان على ان health care professionals والوركرز بشكل عام they should wear masks always حمايه للاخرين، لانه احنا اكثر عرضه لان نتعامل مع مرضى كثير، وخاصه في الخدمات السعافيه EMS. يعني احنا we're subjected to patients في environment ما هو controlled زي المستشفى، فبالتالي يصير ممكن patient suspected ما انتبهنا له or unsuspected and we're carrying a virus without us knowing. That's why wearing a surgical mask للhealth care professionals EMS أيضا أثناء يعني رعاية أي مريض is advised.
طبعا لما نتكلم عن الابيديميولوجي first طبعا الفيروس first came up isolated in Wuhan, China. That was in December 2019. طبعا اتوقع we all got into the news، بعدين قالوا والله في فيروس ونيو فيروس ونوفل فيروس، وبعدين isolated في Wuhan next to the fish market. بعدين things start being يعني a little bit at first nobody thought it's gonna quickly spread to become a pandemic. لكن يعني unfortunately this came as a reality today. وشفنا انه والله اليوم كل العالم trying to fight against this virus.
So what we're trying to say is, first it started in Wuhan, and this is known. Spread was everywhere due to high infectivity of the disease, of the virus. One of the important aspects of COVID, the incubation period is around 1 to 14 days, which means that it takes a long period for the virus to show its symptoms, so you could be carrying the virus without knowing. طبعا most of the patients show the symptoms within 5 days of the disease. Everyone sees or follows the numbers. Around more than 2 million now have been infected by the disease, and mortality varies from 3 to 4%, depending on the world. Alhamdulillah, in Saudi Arabia, we're around less than 1%.
We calculated this just 20 minutes ago. We looked at the numbers. We're around 8,000, maybe somewhere around 8,000, end of 8,000.
10,484 are numbers today.
Yeah, and the mortality was
103 or 104.
103, 104, which equals to 0.9%, alhamdulillah, which is a very good number, and it's promising. Well, inshallah, we hope to keep it at this numbers. طبعا we get a lot of questions. MERS, SARS, and COVID, they're all the same family. They are all beta coronavirus. They follow the same family. As of today, طبعا MERS and SARS are more deadly compared to COVID. However, we don't know if we reach the peak within COVID. So we cannot determine until يمكن 2 or 3 months from now if COVID is as aggressive in terms of mortality as MERS and SARS.
And maybe this is why we get a lot of questions. Why are we collecting all this data? A lot of the healthcare professionals are complaining, and I don't blame them, about all this data being collected from healthcare organizations, legislative bodies in the country. طلبات القطاعات الصحية بشكل عام، تجميع المعلومات هدفها معرفة الوضع الحالي. It is a new virus. The transmission is quick. We want to know more about it. The more we know, the more we can provide better care for our patients, and at the same time protect our healthcare professionals from this virus. The more we know, the more data we gather, the more knowledge we build around this virus will help us combat this situation, and at the same time provide better care for our patients and for our teams. Maybe R0 or R0, which we might hear people talk a lot about في المستشفى وفي الببليك health، هو transmission rate. Transmission rate around one infected person can infect up to 1.5 to 3.5 people, 2 ل 4 تقريبا, if we take it in that sense.
Now we get to the biggest question: how COVID is transmitted between patients, and between what's the routes of exposure that you might be actually facing in an ambulance. Remember, as of today, it's still a droplet. WHO emphasizes that it's a droplet. However, because we are in a dynamic situation within the ambulance, we need to pay a special attention to surfaces. Apparently, we have a lot of surfaces.
نتكلم عن surfaces. يمكن إذا في أحد not from the healthcare, not from EMS, maybe they don't understand how many surfaces we're talking about في الإسعاف. الإسعاف عبارة عن غرفة وزوايا وأركان places where things and viruses can be stuck and difficult to reach. So that's why when we talk about droplet, there's a lot of places to cover, to clean, and to make sure that you don't have problems there, right?
And that's why services, if you are actually handling and dealing with COVID patients, that's one thing you need to keep in mind, because that's most probably will be the route of transmission surfaces. It is, if you do PPE very well and you do the precautions that we will talk about, most probably you won't have a direct contact with patients' droplets, but make sure you cover the surfaces. It can live up to 72 hours on surfaces. A recent study from New England Journal of Medicine 5 days ago looked at how long this virus can survive. Plastic, stainless were the two most common actually surfaces where virus actually can stay on and alive. But even up to 72 hours, they were able to isolate the virus by themselves.
We're getting a lot of questions about what mask did we wear. So طبعا we also received questions about fumigation and cleaning the ambulance. We'll talk about all of this at the end. We're trying to take it in a stepwise approach. يعني من البداية background وكذا إلى أن نوصل لنهاية الجيرني. So when you're talking about droplet, for sure you can wear as a primary kind of protection, you can wear surgical masks. But then going to N95 masks and so on will be, when we'll talk about what the indications are. But for sure, wearing surgical masks in the beginning, and when we're not doing any kind of aerosol generating procedures, then we can wear surgical masks.
Now, again, we will get to the same discussion. How does this patient present to us? Unfortunately, a flu-like symptoms are very common, and not all of them will be COVID positive. However, there are red flags that you need to pay attention to. Usually, COVID positive patients will show up.
Huh?
And maybe in a later stage, moderate stage, they will have. Its likely presentation will be sore throat, runny nose, and diarrhea. And unfortunately, the complication will be pneumonia and ERDS.
طبعا في مثل قديم في شو اسمه الكتب الطب يقول when you hear hooves think horses not zebras. يعني بتسمع يعني صوت ما ادري شو صوت مشي الحصان وشو له اسم بالعربي اكيد له اسم يعني بس انا يعني ما يحضرني. يعني دائما think about what's common. لا نعتقد ان كل مريض الان راح يجينا is COVID. ما نبغى نقصر رعايه طبيه لمريض عنده MI ولا عنده ستروك ولا عنده شيء مقابل انه احنا we think it's COVID. If you think it's COVID, then it's COVID. If you don't suspect everyone. Protect yourself as if every patient could be positive, but provide care appropriately. الشيء اللي ودي انوه فيه الcase definition للCOVID patient changes dynamically. The more information we get, the more the definition gets precise. So if you want to know the updated case definition for COVID-19, please go to the Saudi CDC website, where you'll have updated information for healthcare professionals to know what the newest updates are in regards to COVID-19.
One of the most common tools that we see, and this is what we use in National Guard, is the visual triage tool. Visual triage tool was developed actually in the previous outbreak of MERS. Ministry of Health developed the visual triage tool and then distributed to medical institutions, trying to find out a way to triage based on. Look at it, I know it's not clear, and I do apologize. This is the best version that I can actually get. They look at fever, cough, shortness of breath. If you look to the sore throat and runny nose, you find there is a 0 points on that. And there is a reason for that. It is not always common for MERS or COVID to have a sore throat or runny nose. However, at the same time, we wanted that person who filled the triage tool to pay a special attention if a patient actually presented with sore throat. So sore throat by itself does not eliminate the possibility that this patient is a COVID positive. And then if you look down there, there are a couple of places and high risk procedures and things going on within the society that will actually be calculated when we do the visual triage tool. Again, it depends on your institution. It depends on the ambulance service that you work for. They might have a similar visual triage tool, but this was put into the discussion just to tell you that you might get in contact with triage tools that are similar to what we have so far. If we move to the precautions that needs to be done, now we have to differentiate patients into 3 subcategories. One, the low risk patients. So those patients are not in COVID presentation, they're not anywhere within that. And then we have the high risk patient. Those are the patient presented with a flu-like symptoms. Then we have the positive patients. So regardless if they have symptoms or they don't have symptoms, they are positive. We know they are positive. And when we talk about this slide, we're talking about if you are transferring a positive patient or a high-risk patient. So you know this patient is positive. First thing, and one of the things that maybe Dr. Naufal is familiar with, when MERS outbroke last time, we at our ambulance services did this. What we did is we empty the cabinets. The cabinet is full of equipments, masks, all this stuff. If I allow the provider to reach those cabinets very often, I'm increasing the spreading. And this is one of the reasons why we need to empty the ambulance cabinet. At the same time, just tell me one reason why do I have a delivery kit when I transfer a COVID positive patient? Why?
If you're you know that this might be focused for services where they are transmitting patients that they know are COVID. يعني مريض في مستشفى ومعروف انه هو positive، كيف وبينقل من مستشفى الى مستشفى او من المستشفى نفسه الى مكان اخر في المستشفى. Make sure that اولا this ambulance is purely dedicated for COVID patients, so that we don't have to go back and forth increasing the risk of the infection to other patients when transporting. ثانيا, as Dr. Abdullah said, empty the ambulance from everything else you don't need. Anything that you don't need should not be in the ambulance. نتكلم عن delivery kit، نتكلم عن medication bag that you're not going to use، نتكلم عن suction that you're not going to use. And as you see in the slide, covering other surfaces with plastic. And we did this, and a lot of other services and EMS services do this, where البلاستيك نفسه نتكلم حق البويه اللي نحط في الارضيات والجدران لما تضرب بويه. You cover the whole ambulance from inside with plastic, so that you decrease the chances of the droplets from going into this surface and being a source of infection. It doesn't have to be fancy. شطرطون and plastic to cover the whole inside of the ambulance. This will help us clean our ambulance later and decrease the source of infection. Also, having no sitters in the back of the ambulance. دائما عندنا احنا people want to be with their loved ones during these issues. We should not encourage this. We should try our best to explain and prohibit having anyone else at the back of the ambulance if we don't have to have them. حتى المسعف, we were talking just before we started. If the patient is stable enough to sit alone in the back, stable enough, I mean totally normal vital signs, no airway compromise, no complaints whatsoever, then we shouldn't even have the paramedic or the EMT or the doctor or nurse, whoever accompanying the patient, sit in the back of the ambulance. We also talk about keeping the AC off. I know the weather right now might be a bit hot and getting even hotter within the next couple of weeks, but keep the AC off if possible, because this prevents the virus from being stuck in the ventilation system. طبعا hand hygiene before, after, throughout, as much as you can. لا ننسى 20 seconds for alcohol based solutions and 40 seconds for water and soap. A surgical mask for anyone who's not intubated at the back. We're talking about the patient, because this protects us as providers from getting the infection.
And again, the AC and why we need to turn it off is the last thing I want to have is actually contaminating the AC system. The driver has nothing to do with this procedures, and if a virus gets into that system, it will be a disaster, because the virus will hide, and then even if we do the decontamination, the virus is still there, and that's why the AC needs to be off during the whole trip. طبعا even with the precautions now, if the patient is positive and you know they're positive, there are what we call aerosol generating procedures. CDC define aerosol generating procedures as bag valve mask, oropharyngeal suctioning, endotracheal intubation, nebulizer, CPAP, which is the continuous positive airway pressure, or cardiopulmonary resuscitation. If you look at this actually is what pre-hospital care is about. So, in other words, what I'm saying is 90% of what you are capable of doing is actually aerosol generating procedures. So, even if this is an aerosol generating procedure, sometimes it's not prevented. Sometimes you have to do it. I'm not saying if somebody is arresting with a coding in front of you, you will stop because you said avoid aerosol generating procedure. No, what I said was try to avoid, but at one point you might be forced to do one of these procedures. And when we talk about management, inshallah, of pre-hospital care, we will talk how to do it in a very acceptable, we think, safe way to do it.
So as Dr. Abdullah said, we're not going to withhold care, but we're going to modify the care we present. So as much as possible, we're not going to do any kind of aerosol generating procedures, no nebulization. And we're going to talk about in the next slide, anything that we don't have to provide and will not change outcomes now, we should not do if it is going to generate any kind of aerosols.
Now the next slide is about personal protective equipment.
There's another thing that I want to talk about. I think we didn't talk about in the previous slide, which is يمكن أنت أشطر مني في المجال هذا أبو أحمد، اللي هو أنا ماني paramedic ف I'm not that good at اللي هو الديسباتش. كثير من الزملاء يستجيبون المسعفين بشكل عام، الباراميديك يستجيب لمنزل أو لمكان هو ما يعرف شنو الكيس اللي هو مستجيب له. It would make a huge difference إذا زملائنا في العمليات والمرحلين يعلمون الزميل في الميدان عن طبيعة الحالة اللي هو مستجيب لها. It would make a huge difference إنه يلبس هو البي بي إي، يلبس الجاون، نتكلم عن وش يلبس الآن. بس يعني ونصيحتي للناس في غرف العمليات والمرحلين بشكل عام to develop protocols. develop protocol، والبروتوكول هذا تطبيق يكون سهل وسريع وفي أشياء كثيرة أونلاين. وراح نحاول مع الزملاء في الهيئة السعودية للتخصصات الصحية مشكورين إن to put examples of protocols that can be used automatically. وأنا متأكد في ناس كثير سووا بروتوكولات أصلاً جاهزة للأشياء هذه عندنا في السعودية، على أساس المسعف يكون مستعد لما يستجيب للموقع. وبس أذكر الأسئلة قاعد توصلنا الآن، شاكر الجميع على أسئلتهم، راح نحاول نجيب عليها كلها إن شاء الله في نهاية المحاضرة.
I will add something. It's not always possible to get all information from dispatch. صراحة يعني. I remember exactly in the last shift we got a call. Somebody is reporting somebody else that he might be having a flu-like symptoms. When we got on scene, patient was having actually an abdominal pain, and the only complaint that he had was an abdominal pain. So imagine me coming with gown, N95, face shield, and approaching the patient. The patient was that close to actually have supraventricular tachycardia because What I did was a full protective equipment while I didn't have to. The patient did not have any complaint. He wasn't febrile. He did not have any history of travel. He didn't have any exposure to the COVID positive patient. So you need to be very careful when you are actually gaining this information. And what is the most reliable resource from getting this information? And I think patient will be the answer. So if we talk about personal protective equipment, I like to, that when we talk about donning and doffing of the personal protective equipment, imagine if you are in a war and you are a soldier and you have the weapon just next to you, but you cannot operate that weapon. So you cannot take it, you cannot fire it. What is the point of having a soldier in a front line who doesn't know how to operate or to hold the weapon? And that's exactly what's going on if you cannot do on and do off the personal protective equipment. This is exactly what's going on if you cannot operate the isopod, the negative pressure isolation system. So even though you have a negative isolation pressure system, but you don't know how to actually operate it. So donning and doffing is very important when we talk about PPE. And those that listed there, this is what I think the most important thing to know how to do on and do off and when to do it. So gloves, face shield, surgical mask, and N95 respirator, a powered air purifying respirator, or what we call as PAPR, surgical gowns. The surgical gowns are not the yellow gowns that we are used to see in the ER. It's different. Surgical gowns are usually blue and they are sterile. And you need to be very familiar with the negative pressure isolation system.
We're talking now about transporting COVID positive patient. And you are sure that this patient is COVID patient. We're not talking about every patient.
When we do the do on, remember it's MEG. So you do mask, eye protection with a face shield, بعدين الgown, بعدين الgloves. Last thing you put on is gloves. Now, if you are to do off, then the first thing you need to do is the gloves. But hold on. After you take off your gloves, what do? You go and wash your hands. Then you take the gown. Then you go again and wash your hands. Then you take the eye with the face shield. Then you go and wash your hand. Then the last thing gets done is the mask itself.
لأنك ما تبغى تلمس الماسك حقك اللي فيه اللي عند الوجه ويكون لا سمح الله something in the hands and then or something on the mask itself and then you get on your hands and then after you take off your gloves you touch your face or scratch your eyes and cause an infection to happen. So keeping hand hygiene between every step is important. عبد الله حطها بطريقة حلوة دي on ودي off فدونينج ودوفينج عشان نحفظها ومج وجم عشان نعرف التسلسل.
And again, usually people will actually use alcohol in between. It doesn't matter as long as you do in that order and you do it with those steps. So you cannot jump from one step to another step without actually the hand hygiene procedure. Because if you do so, there is no point of doing that in that order. This is the only reason that I have put this slide is because when I went through university and I went through the ride-alongs and those, no one ever came to me and said, you know what, before you put N95, you need to be fit tested for it. We were saying that if a patient is coughing and there is a blood, then the first thing, jump and get the N95. Hello, there is a fit test. You need to be fit tested to use N95. N95 without fit test for me is useless.
لا طبعا مو بس for you, for everyone. ال N95 إذا ما كان في fit test ليس له قيمة بتاتا. يعتبر مضيع الوقت. فكل قطاع صحي يسوي فيت تيست، وهذا يعني نشوفه كل يوم. الفيت تيست الماسك لازم يكون ما في سيل جيد وما في ليك، بالتالي نعرف انه ال N95 هذا مناسب. من غير ال N95 فيت تيست ما اتوقع انه في يعني مضيعه للمال، مضيعه للوقت لبس هذا، ولا يحميك من شيء يعني بعد الله.
And if we talk about fit test and you ask what is the fit test? Test is the seal, it's actually testing the seal between your face and the mask. That's exactly what it is. There are substances that are used. However, you need to be careful when it comes to the fit test. If you are fit tested to a specific N95 mask, then you need to use the same make, model, or size of that respirator. So if you are, for example, let's say I am fit tested to, I'm not going to say the name of the commercial but just say I'm fit tested to X
medium size.
I cannot use large just because, or regular, just because that's what I have right now. And that's the only thing that is available to me. No, if you are fit tested, then you use the same make, model, and size that is actually your fit test for it. When they do the fit testing, they use substances. Sometimes you can smell it, sometimes you can taste it. It depends on which substance. And I think to discuss the substances is beyond the scope of this lecture. Now, that has been discussed all over and again. We transfer the patient, then what to do? Then you do a decontamination, and it is not somebody else's job, it's your job. You transfer the patient, you know what happened during the transfer. You're the only responsible personnel for me to actually decontaminate that ambulance. So all PPE that is used is considered contaminated, must be disposed in appropriate way with every patient. The ambulance anterior plastic, if you use one, has to be removed. Then we get to what type of materials that we can use to actually decontaminate the ambulance. Well, vaporized hydrogen peroxide is a very good agent. I know Saudi Red Crescent Authority عندهم المachine where you plug it in and then the vapor comes in. So you just put the solution and then the vapor. You leave it for an hour with a closed ambulance and an AC on to ensure that there is a circulation within that compartment.
And we're talking about transferring COVID positive patients.
Yeah, so you know that the patient, I have transferred the positive COVID patients and I'm done. So I'm back to my station, I'm back to my institution, and then I need to do a decontamination. So what's the first thing to do is to clean the ambulance, of course, take out the PPEs and make sure that everything is disposed in a very appropriate way, and then do the vaporized hydrogen peroxide. Now, when pandemics and things start being a little bit busy, at one point, I'm praying that this is not going to happen, but unfortunately, if things start the numbers start increasing and the utilization of hydrogen peroxide increases, at one point you will run out of hydrogen peroxide, and your institution or your agency will not be able to provide hydrogen peroxide. Does this mean we don't have a decontamination? No. Old school always win. Always, when things goes wrong, stick to the basics. So what's the basics? Bleach. Just bleach.
Chlor ومويه.
That's what you need.
And it works.
It works very well. So just bleach, put it in a spray it on all surfaces, ceiling and floor, and leave it for an hour. Then wipe it.
طبعا, what I recommend also is that every institution that have an ambulance service, that they come up, the ambulance department comes up with a protocol and train their people on using that protocol or doing it, and follow it up. Make sure that this protocol is working. أسوأ شيء ممكن يصير الفاريشن، إنه أنا أنظف إسعافي بطريقة وزميلي ينظف إسعافه بطريقة ثانية, then we don't really know what's happening. Coming up with a standard protocol and training people on it, ليس فقط طباعتها على ورق, training people on it and making sure that people are doing it. This will make the biggest difference.
طبعا after we bleach, you use hydrogen peroxide, you use bleach, whatever you like to use. Then you open the window, you start the ventilations of ambulance for at least 30 minutes. Then that unit of ambulance is back to surface. Now, during the decontamination, طبعا the unit will be down, the car cannot be used for any reason, and it has to be locked for almost an hour and a half for decontamination. طبعا the pre-hospital management of COVID. Now, what we're talking about, that include the low risk, high risk, positive, all of them. In that specific chapter of discussion, this actually applies to the low risk, high risk, positive. Now, number one, please make sure you reassure the patient. The patient is already in a phobia without anything. I know for sure there are people who has never been on an ambulance and they get scared حتى من اللايتس والسيرونز لما يسمعونها وهم ما لهم دخل. So they're not even when an ambulance passes by them, they become scared. So their heart rate will go up, they will be tachypneic. So the first thing to do is reassure them. Reassure them that you are here to support them, that in case of لا سمح الله deterioration, and you will actually intervene and you will provide the maximum support possible for them. That's number one. Now, that being said, let's talk about medicine now, and let's avoid aerosol generating procedures again and again and again. يا جماعة, aerosol generating procedure will be the only route for transmission of that patient infection to you and to everybody else. So avoid the aerosol generating procedures. Patient surgical mask should be applied. Now, if patient has a nasal cannula, face mask, non-rebreather mask, I don't care. Put a surgical mask over this device of oxygen. It doesn't matter if he has a nasal cannula. It doesn't matter if he has a face mask. It doesn't matter if he is having a mouthpiece. And we will talk when we talk about nebulization. Just apply a surgical mask over it. طبعا PPEs should be worn all the time. And there is no game here. And you cannot challenge this. PPE for your protection, for the patient's protection, for the community protection. طبعا minimize the personnel and patient compartments. Some hospitals will tell you, well, if you are transferring an ICU patient, then I have to send an ambulance with a nurse. If patient is stable enough, this nurse should not be with the patient. If patient is stable enough, minimize personnel and patient compartment. Make sure that you took every measure possible to actually assure continuation of care. So there is an endorsement that happened before, or you will endorse, but do not take a personnel member to just endorse. This will not be acceptable in this specific situation, because that will increase the risk to infection on both you and that personnel. Now, if we are talking about nasal cannulas and oxygen therapy, طبعا we teach paramedics and pre-hospital care providers always oxygen is good, and try to do a non-rebreather mask. However, in patients with COVID or high risk of upper respiratory infections or flu-like symptoms, nasal cannula is preferred. There is some type of nasal cannula where you can have a high flow nasal cannula, and it can be very helpful. Surgical mask, again, over any device of oxygen therapy. I don't care if it's a nasal cannula, if it's a non-rebreather, if it's a simple face mask. You have to put a surgical mask on the patient. Suctioning. Now, suctioning, avoid suctioning at all means. If not avoided, then do it on scene. So if you find that this patient, yes, he is in a borderline, he might not get an airway obstruction because of that fluids, well, you don't have to go through this. Suction it on scene.
قبل لا يحط في الإسعاف. Before we go to the ambulance, suction, you don't want to suction a patient and he starts coughing and generating these droplets while you're in a closed compartment, which is the ambulance. If you have to do it, but as you see, the first 2 words was avoid. ممكن أضيف واحدة ثالثة, avoid ثالثة أنا. Avoid suctioning as much as possible.
طبعا don't suction without face shield, because it is expected that if I take the catheter tip and I start manipulating in your mouth, a lot of things will happen. A lot of things will come out. So please just make sure you have a face shield on and then start suctioning. Now, if patient is intubated, then please, before leaving that institution, ask them to have an inline suction catheter, because you want to use a system. You want to use a circuit, a ventilator circuit. You don't have to take off the ventilator circuit. You insert a soft catheter into the endotracheal tube, then you start suctioning. No, you don't have to. We have something called inline closed suctioning catheters. It's available in most ICUs. Ask them to do it. So at least if you have to do it, then you are doing it in a closed circuit system. Nebulization, again, with the same with the suctioning, avoid. And I think Dr. Naufal is one of the most people who doesn't like nebulizing medication during transfers with those specific patients.
You should try our best to avoid it. I know that a lot of our patients even ask for nebulization, especially asthmatics or people who are used to doing it. Our goal is providing best care and best protection for healthcare professionals. ما نبغى مسعف أو paramedic EMT يجي لا سمح الله virus because of performing wrong practice. if we have to, then MDI, البخاخ حق المريض نفسه. Otherwise, no nebulization. And if you must, as we said for suctioning, do it on scene.
Do it on scene.
If you must. And I think we don't have to. تكلم عن a number of liters.
We for those for if you have to do it, remember when we do nebulization, it is an aerosol generating. So the higher the flow, the more likely that the aerosols will be actually flying around. So you need to do it as a 6 liter or less. The less, the most efficient way to do it. However, sometimes you need to go higher. It depends on the set and the situation. It depends on the severity of the patient presentation. Now, this patient, that specific patient, he failed, and he has a ventilation now problem, and then we need to bag him. What do you do? Remember, it's a aerosol generating procedure, so extra caution needs to be done on that. You can use a HEPA filter. You can attach it between the bag and the mask, and then you start bagging. The HEPA filter exists for those of you who transfer a lot of ventilated patient on ventilators. It exists. We have it. It's isolated HEPA filter. Usually we put it between the circuit and then the tracheal tube. Take that piece, put it between the mask, will bag, and then you start doing it. Remember, you must maintain tight face seal between the face mask, the mask حق الباج, and between the patient's face, because those borders are the escape for those aerosols. Those are the risk where it can get actually flying around and then you catch it. So make sure you have a good seal. Remember, you're still doing medicine. It's not about infection. Why did you do it in the first place? You did it because patients have to have a back valve mask. So how you do it gently. You just push the bag until you have enough power to have a chest rise, and nothing more than this. Because here's what's going to happen. If you get that bag pushed all way through, what's going to happen? You're actually pushing air into the stomach. And what's going to happen 2 or 3 minutes later? Patient is going to vomit. And then now you have really a serious problem. You need to suction, you need to clear the airway, you need to bag it again, you need to maintain the airway again. So make sure that you're gentle with that bag and you're not pushing too hard.
طيب CPAP ايش رايك فيه ابو احمد؟ تسوي CPAP؟
CPAP is a problem by itself. Now, if you think bag valve mask is a problem, CPAP is the biggest problem. If I am to say one thing that is the most thing I want to avoid in those patients is the CPAP. And the reason why is because, why, doctor?
Because it's going to generate more aerosol particles, which will even fly a further distance. For non-invasive positive pressure ventilation will throw out all these viruses throughout the compartment and increase the risk of this virus to spread. CPAP should not be used in any patient who is suspected of COVID.
Again, to discuss CPAP, يعني الآن بدل ما عندي oxygen flying by, now oxygen flying by مع pressure. So worse than يعني aerosols الآن في pressure مع aerosols. So it will fly for a further distance and with a high pressure on it. So CPAP should be avoided. I know that يعني maybe most of 911 calls or emergency calls will not actually be utilizing CPAP. Usually CPAP will be a problem when we do inter-facility transfers. So we are moving patients from hospital to hospital, from ICU to ICU, from ER to ER, then a CPAP might be there. So if there is a way to actually do it, just make sure you just follow the protocol. Advanced airway management and how to do it, there will be no intubation at all. Intubation is an aerosol generating procedure, we know that for sure. If advanced airway is mandatory, then our first line should be supraglottic airway.
Because you want to decrease the interventions that you're doing to the airway. When you're doing an intubation, معناها you're subjecting the professional paramedic هذا إلى الأيروي حق البيشنت directly, increasing the risk of infection. And this is what we don't want to do. We don't want to harm our patient, but at the same time, we do not want the paramedic to get infected. So decrease the interventions هذه. So use LT, tube, iGel, أشياء كثيرة موجودة, supraglottic airways that can be used. But if you have to intubate, then you have to do it.
Definitely. I mean, we're trying to tell you what to avoid. At one point, you cannot avoid it. So if you have to do it, then you need to do it. That's definitely something we cannot negotiate. But if you have to do it, then it is wise and it is logic to actually try a supraglottic airway before. So do it. If it is enough, then alhamdulillah, khair wa barakah. Now, last thing we want to talk about before hitting questions, adult cardiac arrest. طبعا ال AHA have looked at different algorithms and updates. This is the most recent one when it comes to suspected or confirmed COVID. Nothing really very different from what's we are used to. However, they have emphasized doing PPEs طبعا, starting CPR or starting intubation or a supraglottic airway. And why do they want you to start it early? They don't want you to actually do an aerosol generating procedure such as bagging and then doing that over and over. So you need to be aware of what's going on with that. Again, with the pediatric, it's the same. However, in pediatrics, what you need to remember is that they are more sensitive to hypoxia, and most of their cardiac arrest are caused by what? Hypoxia. So make sure you actually correct the hypoxia very well. You start the advanced airway very early, first station, and then you do it.
طيب. References اللي نخلي عليها أساس إنه الناس يروحون له. في a lot of others that we will try to share with زملاء في الهيئة السعودية للاختصاصات الصحية. إحنا will try to go through the questions that we received inshallah we'll have time to finish some of them. أول سؤال كان يقول عن N95. هل ممكن إنه في طريقة إنه to do it إنه نعرف المقاس حقنا بنفسنا؟ لا. This has to be done through infection control of your department. They are the people who know how to do this test. There is a protocol to do it. You need certain kind of materials. زي ما قال they spray in أشياء لها cinnamon وكذا وريحتها وتذوق طعمها ويخلونك تقول كلام غريب إلى أن تأكدون إنه هذا الفت هو المناسب لك. ف mask fitting tests have to be done through the organization. الأسئلة الأخرى إيش في سؤال بعد about cardiac arrest. We talked about doing cardiac arrest for CPR for cardiac arrest suspected of COVID. The protocol is the same. You should wear your full PPE before providing care. Also, intubation in cardiac arrest itself per se is not encouraged. Intubation in cardiac arrest not related to airway obstruction, I'm saying, is not encouraged and should be delayed. You should do your proper chest compressions in the beginning, and you can do bagging while wearing your full PPE, and then you can go to intubation if needed, if the patient regains pulse, and that can be done on scene before putting the patient in the ambulance. تعقيم الإسعاف أتوقع we talked about.
Yeah, في سؤال هنا وش أفضل محلول لتعقيم الإسعاف, and I think we talked about it. يعني الهيدروجين بروكسايد is the most common one now, وهذا الكشخة حق EMT.
ولو يروحون للأوشا اللي هو osa.gov في a lot of other شو اسمه يعني material to clean ambulances.
Please remember, you always have basics, you always have bleach, and you don't have to go through what's fancy and what's not fancy. If you don't have hydrogen peroxide, you still have a bleach.
Yes.
And you just mix it and just wipe your ambulance with it.
So if you're approaching a patient who is suspected, highly suspected by the screening tool, or positive, then you should wear your N95. N95 mask should not be used routinely. The practice of wearing N95 throughout the day will, even though not seeing patient who is highly suspected, is not correct. So you should only wear it when you're attending to a highly suspected or positive patient. Why should we do it in negative pressure rooms? So we didn't talk about negative pressure rooms in our lecture.
Yeah, we talked a little bit. We touched the isopad. The isopad is the isopad, if you look at it, it's a negative pressure compartment. It is, if you get it, now here is how I was trained to operate an isopad. Up to this point, this is how good it is. If you seal it, then you hear the negative pressure, take off your PPE. Because it's a negative pressure, you don't have to worry about it. However, what we recommend is that you still wear PPE, even if there is an isopad. Because we don't know when this patient is gonna need to be actually intubated and all these discussion that have to go with it.
So isopods are, and if you don't know how they look, if you can Google them after we finish the lecture, isopods زي اليرقة. نحط البيشنت فيه, and this is considered a negative pressure compartment where you can transport your patients in.
في question هنا about the N95 and is it reusable or not reusable. Now let's differentiate between the popper and N95. The popper, most those poppers are reusable. The poppers, you go, you clean it, sterilize it, and then you can use it. N95, no, you just throw it away. It's a one-time use.
But this is all based on local recommendations or every institution. In other places of the world where COVID has hit them hard, some of them have reused N95s. So what we're saying now is for today, this might change tomorrow or the day after tomorrow. Currently, we don't recommend, but this could be.
معاذ رسالة وين ارسلت كيف الواتساب رسالة
وين داخلين دولة؟ طيب. Any other questions? Anna, currently we didn't receive any other questions that are. We have received some questions, but they're out of the scope of our lecture, and maybe we're not the best, like how to clean X-ray departments and other things like that. They're not part of our scope. في سؤال ليش ما يعطى الباراميديك صلاحيات أكثر في إعطاء الأدوية لأن بعض الحالات ممكن يكون علاجها سهل في المنزل بدون نقل. طبعا هذا يعتمد كله على موضوع البروتوكول في المؤسسة اللي يعمل فيها المسعف، ولا خارج نطاق محاضرتنا نعطي recommendation زي هذا. هل يمكن تأخذ مثلا سحب الهواء الساخن حرارة 60 درجة مدة 5 ثواني؟ أول مرة أسمع recommendation زي هذا. recommendation هو التنظيف زي ما قلنا بالهيدروجين peroxide evaporated or with bleach اللي هو كلور المويه، وفي other methods which are OSHA regulated.
في هنا question about doffing within the hospital and how hospitals actually does not like paramedics to doff in their emergency department. I will have to tell you something. Now, in my hospital, in my practice, what we do is we ask the paramedics to doff in the patient's room. So doff, and then عند the patient, they have the appropriate disposable bags, just doff there. Then clean your hands, then walk away. This is my practice. And I know and I understand these questions because some hospitals does not want you to contaminate the corridor with emergency department. So what I am asking you is to pay just a special attention into that and make sure you know what the last thing you want to have is to irritate the emergency department, because we all work in one team and you have to know what the most appropriate way of doffing. The last thing you want to have is throwing that gowns on the floor where it shouldn't be, and then some innocent person will pass by and catch an infection. Worse than that, if they are one of the old patients where they will have complication and we know they might not survive. So make sure you know the protocol, you know what's going on and how the hospital wants you to doff.
طيب, another question is about how to decrease cross-contamination. We have 2 minutes. Cross-contamination of patients in the back of the ambulance. We have to make sure that after treating a patient, we properly clean the ambulance, proper donning and doffing, proper decontamination of the back, decreasing the people in the back of the ambulance. All of the things that we talked about throughout the lecture help us prevent cross-contamination. Dedicating an ambulance for suspected COVID